exercising for long amounts of time may actually be bad for your heart. A review published by the Canadian Journal of Cardiology suggests that long-term intense endurance training may actually restructure your heart and lead to an abnormal heartbeat.
We're joined by Dr. Nesochi from the NYU Langone Medical Center. Thanks so much for being here.
Thanks for having me.
So first of all, what qualifies as intense exercise?
Okay, so when we're talking about high intense endurance exercise, we're really talking about people who engage in marathons, triathlons, things of that sort, many, many hours of very intense training and endurance. We're not talking about people that are working out 2 to 3 times a week for an hour or two. That really doesn't pertain to them in what we're talking about today.
So then what sort of negative impacts did the researchers discover?
So the researchers basically looked at several small studies that showed that those who were involved in these long endurance training and exercise processes, they had some issues with their heart. Specifically, there were some structural changes that could occur that can lead them to have some atrial fibrillation or irregular heart rhythms, essentially.
So this has to do more with people who have a predisposed condition of heart problems rather than exercising too much?
Or does it?
Not necessarily. Okay, so they were looking at people who were involved in high intensity exercise, and they want to see how this is going to affect the heart. They're not really looking at those who are already predisposed to structural defects in the heart.
It's interesting because you think those people of all people would have the healthiest heart, right?